Hey everyone, and welcome back to Study Nurse IQ. I'm Jenny, and in this video, we're diving into the heavy-hitting complications of diabetes. We'll be covering the good, the bad, and the ugly. From hypoglycemia to the life-threatening DKA and HHS, and then we'll wrap up with the long-term chronic complications. This is a critical care topic, so you'll definitely want to pay close attention. Let's get started. Hypoglycemia, low sugar, big problem. First up is hypoglycemia, which is a blood glucose level below 70 milligrams. This is a condition you need to be able to identify and treat quickly. Causes. What causes a patient's blood sugar to drop? Too much insulin or other diabetes medications, skipping or delaying meals, or just eating less than usual, increased exercise or excessive alcohol intake. Signs and symptoms. To remember the classic signs, just think of a patient who is pale, cold, and clammy. A great way to remember this is, if the skin is cold and clammy, you need some candy. Other symptoms include hunger and shakiness, irritability and confusion, blurred vision and headache, diaphoresis, sweating. In severe cases, a decreased level of consciousness or even a coma. Your response as a nurse depends on the patient's level of consciousness. For the conscious patient, give them 15 grams of a readily absorbed carbohydrate. This can be a half cup of juice or soda. After 15 minutes, recheck their blood glucose. If it's still below 70 milligrams per deciliter, give another 15 grams. Once their sugar is above 70, give them a snack with both a protein and a carbohydrate to stabilize their blood sugar. For the unconscious patient, you can't give them anything by mouth. Instead, administer glucagon via the IM or subcutaneous route. Remember this phrase: when the glucose is gone, your patient needs glucagon. This will help the liver release stored glucose to raise blood sugar. Hyperglycemic crises, DKA and HHS. Now let's tackle two serious life-threatening complications that every nurse must know: diabetic ketoacidosis, DKA, and hyperglycemic hyperosmolar state, HHS. While they both involve high blood sugar, their causes and specific lab values are different. DKA, diabetic ketoacidosis. DKA is a severe complication that most often affects type 1 diabetics and has a rapid onset. It's characterized by three key findings. Hyperglycemia. Blood glucose levels are typically above 300 milligrams per deciliter. Ketones. A breakdown of fats leads to the production of ketones in the blood and urine. Metabolic acidosis. The presence of ketones makes the blood acidic with a pH less than 7.35. Signs and symptoms. Because of the high blood sugar, you'll see the classic 3 Ps: polyuria, frequent urination; polydipsia, excessive thirst; and polyphagia, excessive hunger. The body's attempt to compensate for acidosis also causes Kussmaul's respirations, deep, rapid breathing, and a distinct fruity breath odor. HHS, hyperglycemic hyperosmolar state. HHS is more common in type 2 diabetics and has a more gradual onset. A good memory trick is to look at the name HHS with 2 H's, just like type 2 has 2 2's at the end. HHS is defined by extreme hyperglycemia. Blood glucose levels are severely high, often over 600 milligrams per deciliter. Severe dehydration. Patients are profoundly dehydrated, leading to hypotension and weakness. No ketones. There is little to no metabolic acidosis because the body is still producing some insulin, which prevents the breakdown of fat and production of ketones. Treatment for DKA and HHS. The first step is always to identify and treat the underlying cause, whether it's an infection or noncompliance. Your primary nursing interventions will include administering IV fluids and insulin to rehydrate the patient and lower blood sugar, monitoring blood glucose levels hourly with a goal of bringing them under 200 milligrams per deciliter, closely monitoring potassium levels. In DKA, potassium is often initially high due to the acidosis, but as you give insulin, potassium shifts back into the cells, potentially causing dangerous hypokalemia and life-threatening dysrhythmias. You may need to give a potassium supplement. Chronic complications of diabetes. The long-term complications of diabetes are a serious concern and highlight the importance of patient education. Uncontrolled diabetes can affect nearly every system in the body. Cardiovascular disease leads to an increased risk of MI and stroke. Diabetic neuropathy, nerve damage that can cause pain, numbness, and lead to foot injuries and infections. Nephropathy, kidney damage that can progress to kidney failure. Retinopathy, damage to the eyes that can lead to blindness. Gastroparesis, impaired digestion due to nerve damage in the stomach. Sexual dysfunction and dental issues are also common. NCLEX style quiz time. Question 1. A nurse is caring for a patient experiencing a blood glucose level of 55 milligrams. The patient is conscious and able to swallow. What is the most appropriate initial nursing intervention? A. Administer glucagon IM. B. Provide 15 grams of a simple carbohydrate like juice. C. Give a complex carbohydrate snack like crackers and peanut butter. D. Place the patient in a high Fowler's position. The correct answer is B. Provide 15 grams of a simple carbohydrate like juice. Rationale. For a conscious patient with hypoglycemia, the immediate action is to provide a fast-acting carbohydrate to raise the blood glucose level quickly. Question 2. The nurse is reviewing the lab results for a patient admitted with a hyperglycemic crisis. The nurse notes a blood glucose of 680 milligrams per deciliter, absence of ketones in the urine, and no evidence of metabolic acidosis. The nurse suspects the patient is experiencing which condition? A. Diabetic ketoacidosis, DKA. B. Hypoglycemia. C. Hyperglycemic hyperosmolar state, HHS. D. Metabolic syndrome. Correct answer, C. Hyperglycemic hyperosmolar state, HHS. Rationale. HHS is characterized by extremely high blood glucose levels, typically 600 milligrams per deciliter, severe dehydration, and an absence of ketones and metabolic acidosis. Question 3. The nurse is providing discharge teaching to a patient newly diagnosed with type 2 diabetes. Which of the following chronic complications should the nurse educate the patient about to emphasize the importance of blood sugar control? A. Cardiovascular disease and gastroparesis. B. Cystic fibrosis and asthma. C. Rheumatoid arthritis and lupus. D. Appendicitis and pancreatitis. Correct answer, A. Cardiovascular disease and gastroparesis. That's it for the complications of diabetes. I hope this video helped you understand these critical topics. Be sure to subscribe to our channel, like this video, and I'll see you on the next one.